Hey everyone! Welcome back to the channel. Did you know your liver performs over 500 vital functions, including detoxifying your body, producing bile for digestion, and storing essential nutrients? Despite its incredible resilience, the liver can be silently damaged by factors like excessive alcohol, obesity, viral infections, and even medications. What's alarming is that the signs of liver damage often go unnoticed until it's too late. Recognizing these subtle and unusual signs of liver damage can make all the difference in catching problems early and getting the treatment you need. If you've noticed any of these symptoms, don't wait. Consult a healthcare provider to evaluate your liver health. Today, we're diving into 12 surprising warning signs of liver damage you might not be aware of. Stay tuned, because some of these symptoms could be happening to you or someone you love right now. Let's jump right in. 1. Spider-like blood vessels, spider angiomas. Let's start with a fascinating yet potentially concerning symptom, spider-like blood vessels, medically known as spider angiomas. These are small, red clusters of blood vessels that resemble a spider's web, typically visible just beneath the surface of the skin. You'll most often find them on areas like your face, neck, upper chest, or arms. What's really interesting about these angiomas is their appearance. A central red spot with tiny vessels radiating outward, just like a spider's legs. But why do they form? The answer lies in your liver. When the liver is damaged, it can't metabolize hormones, particularly estrogen, as efficiently as it should. This imbalance leads to the dilation of small blood vessels, creating these unique spider-like patterns. Now, here's an important note. In certain cases, spider angiomas can be completely harmless. For instance, they're common during pregnancy or in individuals using hormonal medications like oral contraceptives. However, if you suddenly notice more of these clusters appearing, or if they seem to be growing in size, it's a potential warning sign of liver dysfunction, particularly conditions like cirrhosis. 2. Red palms, palmar erythema. Next, let's focus on your hands. Have you ever noticed that your palms are unusually red, almost blotchy? This condition is called palmar erythema, and it's another subtle yet significant indicator of potential liver damage. So, why do your palms turn red? The answer lies in hormonal changes. When your liver isn't functioning properly, it struggles to regulate certain hormones, especially estrogen. The imbalance leads to increased blood flow to the capillaries in your palms, causing that telltale redness. You'll typically see the redness more pronounced at the base of your thumb and little finger. And while this condition isn't usually painful, it's worth noting as a potential symptom of liver disease, especially cirrhosis. Of course, there are other reasons your palms might turn red. Pregnancy, for example, can cause similar hormonal shifts, as can conditions like rheumatoid arthritis. But if you're experiencing this symptom without any clear explanation, it's a good idea to investigate further. 3. Swollen abdomen, ascites. Let's move on to a more noticeable but equally serious symptom, a swollen abdomen, medically known as ascites. Ascites occurs when fluid builds up in the abdominal cavity. It's often a sign of advanced liver disease, such as cirrhosis, and can cause significant discomfort. But why does this happen? It all comes down to the liver's impaired function. When the liver is damaged, it struggles to maintain normal blood flow and protein production. This leads to increased pressure in the liver's blood vessels, causing fluid to leak out. Reduced production of albumin, a key protein that helps keep fluids in the bloodstream. As a result, fluid collects in the abdomen, causing noticeable swelling. People with ascites might also experience rapid weight gain, difficulty breathing, or a feeling of tightness in their stomach. This isn't just about discomfort. It's a serious condition that can lead to complications. For example, fluid buildup can become infected, causing a potentially life-threatening condition called spontaneous bacterial peritonitis. If you notice a swollen abdomen, especially if it's accompanied by other symptoms of liver damage, don't delay. Seek medical help immediately. Early diagnosis and treatment can make a significant difference. 4. Itchy skin, pruritus. Have you ever experienced persistent, unexplained itching, especially on your palms or soles? This symptom, known as pruritus, could be more than just a skin issue. It might be linked to your liver health. Here's what happens. When bile flow from the liver is reduced or blocked, bile salts, which are normally processed and excreted, start to accumulate under the skin. This buildup triggers an intense itch that can feel almost unbearable at times. What's interesting is that the itchiness often worsens at night and, in many cases, comes without any visible rash. This can make it both frustrating and difficult to diagnose. While itching can have many causes, such as allergies or dry skin, if over-the-counter remedies don't provide relief, it's crucial to dig deeper. Persistent pruritus might be pointing to liver issues, such as cholestasis, where bile flow is obstructed, or other liver dysfunctions. 5. Dark urine. Have you noticed that your urine looks unusually dark, even if you're staying well hydrated? Dark-colored urine can be a key indicator of a bilirubin buildup in your body, a substance your liver is responsible for processing. Here's how it works. When red blood cells break down, they release bilirubin, which is then processed by the liver and excreted through bile or urine. But when the liver isn't functioning properly, bilirubin levels rise in your bloodstream, causing your urine to turn dark yellow, brown, or even orange. This symptom often doesn't appear alone. It's commonly associated with jaundice, a condition where the skin and the whites of the eyes take on a yellowish hue. 6. Pale stools. Here's something you might not think about often: the color of your stool. Believe it or not, it can reveal a lot about your liver health. Under normal conditions, bile, a substance produced by your liver, gives your stool its typical brown color. But when the liver isn't functioning properly, or if there's a blockage in the bile ducts, the amount of bile reaching your intestines drops significantly. The result? Stools that appear pale, clay-colored, or even white. This change in color could indicate serious issues, such as bile duct blockages, gallstones, or advanced liver disease. And here's the kicker: if you notice pale stools alongside dark urine, it's a strong indicator of liver dysfunction. While a single occurrence might not be alarming, persistent pale stools are a clear signal to consult your healthcare provider. 7. Easy bruising and bleeding. Have you noticed yourself bruising more easily than usual or experiencing frequent nosebleeds? This could be your liver trying to tell you something important. One of the liver's key roles is producing clotting factors, proteins that help your blood coagulate after an injury. When the liver is damaged, its ability to produce these proteins diminishes, making it harder for your blood to clot. The result? Easy bruising, prolonged bleeding, and sometimes even bleeding gums or heavy menstrual periods. If minor bumps or cuts lead to excessive bruising or take longer to stop bleeding, it's not just an annoyance, it's a red flag for potential liver dysfunction. 8. Chronic fatigue. Do you often feel tired no matter how much rest you get? Chronic, unexplained fatigue is one of the most commonly overlooked signs of liver damage, and yet, it can have a huge impact on your quality of life. Here's why this happens. Your liver is a powerhouse when it comes to energy metabolism. It helps break down nutrients and convert them into energy for your body to use. But when your liver isn't functioning properly, this process slows down, leaving you feeling physically and mentally drained. This kind of exhaustion isn't just the result of a busy schedule or lack of sleep. It's the kind that doesn't go away even after rest. You might find it hard to focus, complete tasks, or muster up the energy for daily activities. 9. Swollen legs and ankles, edema. Have you noticed swelling in your legs or ankles? This condition, called edema, is often linked to issues with your liver. Your liver produces a protein called albumin, which helps regulate fluid levels in your bloodstream. When the liver is damaged and doesn't produce enough albumin, fluid begins to leak out of blood vessels and accumulate in the surrounding tissues, particularly in the lower extremities. While edema can result from other conditions, like heart or kidney problems, when it occurs alongside other liver-related symptoms, like jaundice, dark urine, or chronic fatigue, it's a significant warning sign. 10. Nausea and vomiting. Feeling queasy or experiencing frequent vomiting. While these symptoms can result from many common issues, they may also point to a problem with your liver. The liver's job is to filter toxins from your bloodstream and aid in digestion. But when the liver isn't working as it should, toxins begin to accumulate in your system. This buildup can lead to nausea, vomiting, and other gastrointestinal distress. These symptoms might come and go, but when they're persistent, especially if paired with other signs like jaundice, dark urine, or pale stools, it's a clear signal that something could be wrong with your liver. 11. Jaundice. One of the most recognizable signs of liver damage is jaundice. This condition causes the skin and the whites of your eyes to turn yellow, and it happens because of an accumulation of bilirubin in your blood. Normally, your liver processes bilirubin and excretes it through bile. But when the liver isn't functioning properly, bilirubin levels rise, leading to this noticeable discoloration. Jaundice often doesn't come alone. It's commonly accompanied by dark urine and pale stools, forming a triad of symptoms that strongly suggests liver dysfunction. 12. Confusion and cognitive problems, hepatic encephalopathy. Finally, let's talk about a lesser-known but potentially life-threatening sign of liver damage: cognitive issues, like confusion, memory problems, or even personality changes. These symptoms are often linked to a condition called hepatic encephalopathy, which occurs when the liver can no longer efficiently filter toxins, such as ammonia, from the bloodstream. As these toxins build up, they begin to affect brain function. The result? Symptoms ranging from mild confusion and forgetfulness to severe disorientation or even coma in advanced cases. Conclusion: recognizing these subtle and unusual signs of liver damage can make all the difference in catching problems early and getting the treatment you need. If you've noticed any of these symptoms, don't wait. Consult a healthcare provider to evaluate your liver health. Taking care of your liver is a lifelong commitment. You can support your liver by eating a balanced diet, staying physically active, limiting alcohol intake, and scheduling regular medical checkups. Thank you so much for watching today's video. If you found this information helpful, please like, share, and subscribe to our channel for more health